Right, hi folks, this is Andrew. In this video we're going to have a look at the medial muscles of the thigh, so the muscles running down the inside of the thigh, the medial compartment. We're going to have a chat about what these muscles do, their sort of shared function. We're going to have a chat about the nerve that supplies all of them, the obturator nerve, which is nice and easy because it's one nerve for all of them. And then we're going to have a look at the muscles in detail, have a think about their origins and insertions, and have a think about how to try and find these muscles, like in an exam sort of thing. Not too bad, the medial muscles of the thigh. I think the trickiest bit is finding these muscles on like actual specimens. So yeah, we'll definitely have a chat about that. So my basics to build on for this video, if you take nothing else away from this video, I want you to take away: 1, the medial muscles of the thigh are all primarily involved in adduction of the leg. 2, all of these muscles are innervated by the obturator nerve. When you hear medial compartment of thigh, you should think obturator nerve. Number 3, there are 6 muscles in this group to know about. 3 of them are literally called adductor, and then there are 3 others. So that's a nice way to sort of divide them up. Number 4, in very general terms, when you think about the medial compartment of the thigh, origins and insertions, you should be thinking pubis to posterior femur, as a very general thing. If you're thinking about these muscles, your general ballpark is they run from the pubis to the posterior femur. And then finally, number 5, gracilis is definitely your friend in identifying muscles of the medial compartment of the thigh. Those 5. Okay, right, let's crack on with it. Okay, just a very quick mention to make sure we're all perfectly clear. So these muscles of the thigh, they run down the inside of the thigh. Their role is going to be an adduction of the hip joint, adduction of the thigh. So I'm hoping we're all happy that adduction is going to be, if this is an anterior view, adduction is going to be bringing the leg that way. You're pulling the thigh rather, back towards the midline, okay? This would obviously be the hip A abducted, A B-ducted out to the side, and then it's your adductor muscles that bring it back to the midline, So from a functional point of view, obviously anything that involves you pressing your thighs together is going to be involving these muscles. So I think the classic example used in textbooks is like riding a horse, where you're having to press your thighs together. But I mean, even more generally, we use these muscles often subconsciously when we're just standing or walking. When you're just standing up straight, these muscles are helping to sort of stabilize your center of gravity when you're standing on 2 feet. Again, things like, what can we use? Like when you're off balance, like say you're on a boat or something, like anything that sort of knocks you off balance, these muscles are going to have a big role to play in stabilizing your trunk, So that's the role of these muscles, adduction of the hip, bringing the thigh back towards the midline. Just be very clear on that. Okay, next up we've got the obturator nerve. So like I said, all of your muscles of the medial compartment of the thigh, they're all innervated by the obturator nerve. So that is definitely sort of a big link that you need to have in your head. If you're ever asked for a muscle that is innervated by the obturator nerve, you're thinking medial compartment. If you're asked to identify the nerve that innervates the medial compartment, it's always going to be the obturator nerve, So obturator nerve is the buzzword. Again, try not to have that as just like an abstract thing in your head. Oh, there's this thing called the obturator nerve that supplies all these muscles. Use this as an opportunity to actually learn about the obturator nerve and where it comes from, where it goes, etc., etc. So obturator nerve, like most of the nerves that supply the lower limb, the muscle of the lower limb, it is coming off your lumbosacral plexus. So there are multiple plexuses coming off the spinal cord, which is basically where all of the various nerve roots, the spinal nerves coming off, all mesh together and swap fibers and come together and come apart, so that you end up with all these nerves out the other side. And I'm not going to do the lumbar plexus in a huge amount of detail, but the obturator nerve is formed out of 3 nerve roots that contribute to that plexus. It comes out of L2, L3, and L4. So remember, down at the bottom of the spinal cord. Your nerve roots always come out underneath their associated vertebra. So the L2 nerve root will come out underneath L2, L3 will come out underneath L3, and L4 will come out underneath L4. Yeah, and within the larger lumbar plexus, which I'm not going to draw in detail, but within that plexus, ultimately these three nerve roots come together to form the single obturator nerve. Yeah. Now, just as a sort of little interesting point of view, L2, L3, L4 is also what creates the femoral nerve, which supplies your anterior thigh. Yeah. So don't get that mixed up. Or maybe you can afford to get it mixed up actually, because both the femoral nerve and the obturator nerve, they both come from L2, L3, L4. Okay. But we're talking about the obturator nerve. So L2, L3, L4 come together, form the obturator nerve. Yeah, and that comes out the other side of the lumbar plexus. There's loads of, there's a muscle big muscle here called psoas major, which is sort of in front of all of this. So you can't really see this plexus on a lot of specimens and stuff like that unless you take the muscles away. So this is happening behind the muscle. Once it's been formed, the obturator nerve will then go down into the pelvis. Yeah, it's not going to go straight through the pelvis. You think about the actual space, it can't just dive straight through that because there's stuff in the way, isn't there? There's bowel, there's reproductive organs, there's the bladder, there's the rectum, there's other stuff filling this space. So what you tend to find is these nerves that come down through the pelvis, once they get as far down as here, which is effectively your pelvic inlet, yeah, that smaller circle, underneath the big wings of the ilium here. Once it gets down here, it will follow around the pelvic inlet. Yeah, it will follow the bowl round the edges. Yeah, rather than just diving straight through the middle because there's stuff in the way here. Okay. So it will follow it'll follow the pelvic inlet all the way around, right to the front of the pelvis. Yeah, bearing in mind sort of this is the pubis, isn't it? Yeah, or this is the pubis, this is going to be your ischial tuberosity. And these holes here, right at the front of the pelvis, this is where the obturator nerve gets its name. This is your obturator foramen. Yeah, now obturator foramen, if you look at what obturator means blocked or obstructed, because actually in living anatomy, these aren't holes. There are membranes in front of it, there's muscles in front of it, there's membranes behind it, there's muscles behind it, yeah? So it's actually completely blocked with connective tissue and muscular tissue, etc., etc. Because of that, there are very few structures that are actually able to get around all of that and pass through the obturator foramen. And all of those structures are called obturator. So your obturator artery travels through the obturator foramen. Your obturator vein travels through the obturator foramen. And true to form, once the obturator nerve has made its way around the pelvic inlet, it will then come down and pass through. So from back to front, yeah, it travels anteriorly through the obturator foramen. So this is actually behind the superior pubic ramus, and then out through the obturator foramen, and then into the medial thigh. Yeah, if this is the femur, then this is going to be the medial thigh. And the obturator nerve is then able to split into various branches. In very general terms, there's an anterior branch of the obturator nerve and a posterior branch of the obturator nerve. That's definitely, I would say, as much detail as you need to go into. Yeah, so we would call this the anterior branch, and this would be the posterior branch. And these are going to be responsible for supplying the muscles that we're going to talk about, but also supplying some sensation to the skin. Yeah, so the anterior branch of the obturator nerve supplies a lot of the skin of the medial thigh, which makes sense because we're talking about the medial thigh muscles, aren't we? Yeah. The posterior branch of the obturator nerve actually goes all the way down as far as the knee joint and actually contributes to some of the sensation of the knee joint itself. Yeah, so that's the sensation aspect of the obturator nerve. Okay, but for the point of view of this video, we're thinking about the muscular anatomy. It is going to be both of these branches that supply the muscles of the medial compartment of the thigh. Okay, so that's the obturator nerve. Just, that's enough to be getting on with for now, I would say. The things to take away is L2, L3, L4 form the obturator nerve within the lumbar plexus. the obturator nerve will then go down into the pelvis, work its way around the pelvic brim. It is going to be the only nerve which passes through the obturator foramen. So in terms of trying to find this nerve on like a specimen, that's the place to look. Yeah, if you can go to your obturator foramen and you see what looks like a nerve darting through it, it can only be the obturator nerve. Yeah, and then once it passes anteriorly through the obturator nerve, it's into the medial thigh, and then we've got our anterior and our posterior branches which supply all of the muscles and various bits of the skin. Okay, I hope that makes sense. I hope the diagram makes sense. Yeesh. Okay, so the muscles themselves, yeah. So said there are 6 muscles in the medial compartment of the thigh, or yeah, I would argue that there's 6 muscles in the medial compartment of the thigh. 3 of them are called adductor, adductor, and then there are 3 others. Yeah, so that's a nice way to sort of break the muscles up into smaller groups. Yeah. Now, with regards to origins and insertions, like I said right at the beginning of this video, it's always good to have a very, very general idea about origins and insertions before you dive into the details. You try and learn the details too quickly or too soon, you just get overwhelmed and disengage, yeah? So make sure you've got the big picture first before diving into the details, yeah? It makes it much easier to remember. So as a general rule, the medial compartment of the thigh, all of these muscles are going to be coming off here, which is sort of your ischiopubic part of the pelvis, yeah, that front of the pelvis. And if you think, so we've got, this is the pubic body, we've got the superior pubic ramus here, we've got the inferior pubic ramus here. This at the bottom here is going to be the ischial tuberosity, ischial tuberosity. Yeah, obviously the pubic symphysis right in the middle, yeah, dividing the right pelvis from the left pelvis. And obviously this space here is going to be the obturator foramen. Yeah, I hope that's clear. I'm not going to win any awards for my anatomical illustrations, but you're going to have to just bear with me. Okay, fine. And then, so most of these muscles are going to come from the ischiopubic part of the pelvis, and in the vast majority of cases they are then going to insert onto the posterior femur, the back of the femur. Yeah, now I've drawn this from an anterior perspective because I think when it comes to looking at specimens or models and trying to identify these muscles, it's still far easier to identify them from an anterior point of view, which is why I'm going to draw them from an anterior point of view. But just have in the back of your head, the insertion of most of these muscles is going to be on the back of the femur, yeah? And we've got a couple of landmarks, bony landmarks on the back of the femur that are worth remembering with regards to this group of muscles, yeah? By far the biggest one is your linea aspera. So if you look on the back of a bony femur, yeah, you look on the posterior aspect, there is basically this appearance of, you've got a couple of lines coming together at the top to form then a single line which goes down most of the femur, which will then split into another 2 lines at the bottom. Yeah? And that's sort of, this is on the back of the femur, not the front, the posterior aspect. But this sort of appearance you will sort of see on most bony femurs. And the big line in the middle, yeah, that is your linea aspera. Okay, so just bear that bony landmark in mind. Okay, so let's have a think about the muscles themselves. How am I going to do this? We'll do the muscles that are actually called adductor first. Yeah, so we'd have 3 muscles that are all called adductor. Yeah, but then the 3 are then called adductor longus, adductor brevis, and adductor magnus. Okay, so longus, brevis, magnus, and if you know what the names mean, then it gives you an indication of what you should be looking for in these muscles. Yeah, longus because it's long. Yeah, brevis means short. Yeah, so if longus is long, then brevis is short, and magnus just means fucking huge, yeah? So really, really big muscle, adductor magnus, okay? So they're the sort of things to look for. Now, I've written them in this order because from an anterior view, this is the order that you'll see them, yeah? From front to back, longus, brevis, magnus, yeah? I always used let's be muscles to remember that, yeah? Quotation marks. Let's be muscles. So when you're looking from the front, you'll see adductor longus first. You might just have to peel it away to find brevis underneath, and then underneath that, you'll see part of magnus. Magnus is so big that you'll see it in other places, but that's the way to sort of think about it. Okay, starting with adductor longus. Yeah, so adductor longus. So let me just rid of some of these labels because we've seen them, yeah. So adductor longus. So as we said, starting from the ischiopubic part, ischiopubic complex, yeah. In particular, we're mostly coming off the body of the pubis for adductor longus, yeah. We're starting sort of round about here, yeah. And then, because it's the long one, it's the long muscle, adductor longus is going to go all the way down to about the middle third of your linea aspera, yeah? So it's going to come all the way down here. It will then obviously go behind the femur, yeah? Remember, it's going behind the femur to then insert onto the middle third of your linea aspera. Adductor longus. Yeah, so, and like I said, this is one of the more anterior muscles of the medial compartment of the thigh, yeah? Fun fact about adductor longus contributes to something called the femoral triangle, depending on whether you've learned about that or not. Your femoral triangle is sort of right in the groin, and it's where you look for all of your big femoral femoral vessels, yeah? Femoral artery, femoral vein, femoral nerve, yeah? That's a triangle in the groin, and adductor longus contributes to the medial border of that triangle. Yeah, the triangle itself is kind of sort of there-ish. Yeah, so adductor longus is the medial border of that. But yes, you should be able to see adductor longus quite easily from an anterior perspective. Pubic body down to middle third of linea aspera. Nice and easy, yeah? Brevis, adductor brevis. So remember, brevis has to be shorter than longus, yeah? Otherwise it wouldn't be called brevis, yeah? And it's going to be behind longus, yeah? A lot of the time you have to move longus out the way in order to see brevis behind it, yeah? Adductor brevis, pretty much exactly the same origin, yeah? We're still talking the body of the pubis. Maybe it's a little bit further down, you know, in keeping with it being shorter, yeah? So maybe we're sort of moving into the inferior pubic rami, so sort of here-ish as the origin, yeah? But again, it's going to go down, it's going to go behind the femur, and because it's shorter, it's not going to be the middle third of the linea aspera, it's going to be slightly higher up of the linea aspera because it's a shorter muscle, yeah? So we're going to go down here, and then behind the femur to insert onto the back. Yeah. Yeah, nice and easy, yeah? And actually, adductor brevis, so it does insert onto the linea aspera. It's actually so sort of short and so high up. There is actually a part of it, maybe I should draw it more like this. And sort of scribble that in, because it does insert a little bit onto this dotted line that contributes to the linea aspera, and this is called your pectineal line, which we'll revisit when we look at pectineus, the muscle, yeah? But yeah, that's adductor brevis. Okay, slightly behind. If we go all the way up here, yeah, you would have to move longus out of the way to see brevis underneath it. Yeah? Good. And then finally magnus. So magnus means huge, yeah? So this is going to be a very, very big muscle. One of the, definitely the biggest muscle in the medial compartment of the thigh. Has a very big origin, yeah? So it will originate off pretty much the entire inferior aspect of this ischiopubic sort of complex. Is going to come off all of this Yeah, and generally speaking, you can divide adductor magnus into two parts, and you might see this written, yeah? There's what's called the hamstring part and the adductor part, yeah? Now, we'll talk about that in a second. But yes, so adductor magnus comes off the entire inferior aspect. So this is the ischial tuberosity, it's the ischial ramus, it's the inferior pubic ramus, it's the bottom part of the pubic body, the entire underneath bit here, yeah? And then because it's so big, yeah, adductor magnus is going to attach pretty much to the entire length of the posterior femur. Yeah, it is really going to go, so we're going to go across here and then travel underneath to insert down here. We're then pretty much going to insert all the way down here, yeah. Let me just draw this in like that. Yeah, so all of this, 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 and then all of that sort of behind the femur. This is all adductor magnus. Yeah, really, really huge muscle. Yeah. Now, I've sort of not really completed it down here. Let's just finish this picture first. Yeah. There is a bit of a weird sort of gap at the bottom of adductor magnus, because the other place that adductor magnus attaches, instead of just the back of the femur, there is a small tubercle, there's a small landmark, bony landmark on the medial side. Yeah, so this is the medial condyle. There is a small tubercle here, which is called the adductor tubercle. Nice and easy, yeah? Adductor tubercle, yeah? And actually, the adductor part of adductor magnus is going to insert down here, yeah? But then we sort of come up here like this, yeah? So this is all still adductor magnus, yeah? That attaches to the adductor tubercle, but we can sort of see with the eye of faith, we've got this sort of gap. We've got this gap here. It doesn't go all the way down to this tubercle. There's sort of like a hole, like an arch, sort of here, yeah? Now, this arch, this hole in adductor magnus is actually very, very important. It's part of what's called the adductor canal, and this is how all of your femoral vessels, your femoral artery, your femoral vein, the saphenous nerve, I think it's the saphenous nerve, this is how they go from the front of the thigh to the back of the thigh, yeah? You've got all of these vessels, structures coming down here, coming down the front of the thigh. Eventually they need to go behind the knee joint, and the way they go behind the knee joint is they dive through this hole that is made by adductor magnus, yeah, by this archway here. Okay, so that's adductor magnus coming off the entire inferior aspect of the ischiopubic complex, yeah, and then we have this hamstring part that basically inserts onto the entire length of the posterior femur, yeah? And this is called a hamstring part because, yeah, fine, it is an adductor, but a muscle that inserts onto that much of the femur is going to have a role with extending the thigh. It's going to pull the thigh backwards, yeah? So that's the hamstring part in the sense that it has a role in extending the thigh, yeah? And then at the bottom, we've got this adductor part here, which inserts onto the adductor tubercle, and that creates this arch, which is part of your adductor canal that various femoral structures can pass through. I'm not going to talk about that in any more detail, can potentially do a separate video on it. But yes, that's the sort of appearance of adductor magnus, okay? So these are the three muscles called adductor, yeah? Adductor longus, adductor brevis, adductor magnus, yeah? Now you could argue I've probably drawn this in precisely the wrong order because it now looks like the red is overlapping everything else. Yeah, I fucked that, never mind. Just remember it's the other way round, yeah? So if you're looking from anterior to posterior, longus is the most anterior of these muscles, then brevis, and then magnus is actually at the back. Let's be muscles. Longus, brevis, magnus from front to back. Okay? if you looked at that just as it is, then it makes no sense whatsoever. Okay, and then we've got the other three muscles. Yeah, so I've got rid of the previous train wreck. Let's start from scratch. Yeah, and so we talked about the three adductor muscles: adductor longus, adductor brevis, adductor magnus. Yeah, there are three other medial compartment muscles, which brings up our total to 6. Yeah. Now the first one I'm going to talk about is pectineus. Pectineus. Now this is one that can cause a bit of confusion and a bit of discrepancy, because I think different sources will say different things about pectineus. Some sources will put pectineus in the medial compartment of the thigh because it definitely is an adductor of the thigh. No one can argue with its function. Functionally, it belongs with these muscles. Yeah. Some sources that you read will potentially put pectineus in the anterior thigh muscles rather than the medial thigh muscles. And the reason for that is because neurologically, pectineus is often innervated by the femoral nerve in a lot of people. There is some discrepancy. In some people, it's mostly the femoral nerve. In some people, it's mostly the obturator nerve. In some people, it's a combination of both. Yeah, but I think in the majority of people, the majority of innervation of pectineus is actually the femoral nerve, which is why neurologically you could argue that it belongs in the anterior compartment. Now, from an exam point of view, that's an absolute pain, yeah, and it's worth checking with your uni or whatever to see what they formally teach. From like a learning perspective, it's actually quite interesting, and I would argue actually helps you remember things far better if you understand why there's potentially discrepancy between sources. So I'm a big advocate for thinking of pectineus as belonging in both the anterior thigh and the medial thigh, because then it guarantees that you remember those little like exception-y nuances about it. Yeah. So pectineus, I will definitely talk about pectineus in the anterior thigh as well, but I'm going to talk about it here as a adductor of the thigh. Okay, so pectineus, nice and easy. Pectineus predominantly comes off the superior pubic rami. So true to form, we're starting here as a general rule. Yeah, so pectineus is going to start round about here on the superior pubic ramus, and then it is going to insert onto one of the two lines that make our linea aspera. Yeah, it's this medial one, and this is literally called the pectineal line. Pectineal line. So it's nice and easy to remember. Yeah, so pectineus is going to come down here and then insert onto this line like that. Okay, and that's pectineus. Nice and easy. Yeah? Next one is, what am I going to do next? Let's do obturator obturator externus. So obturator externus. So obturator externus, think about the name. Yeah, what does the name tell you? Obturator, we've already come across it, is evidently referring to the obturator foramen, that hole at the front of the pelvis. Yeah. Externus means outside, yeah, on the external side. Remember I said the obturator foramen is completely obstructed, it's completely blocked because it's got muscles in front of it and it's got muscles behind it. Obturator externus is the muscle that blocks the front, the outside of the obturator foramen. Yeah, so that's how you remember it, okay? Again, why do I keep doing this the wrong way round? Well, it's too late now. Fine. So obturator externus is coming off the outside of the obturator foramen, yeah? It is actually deep. It's deep to pectineus. It's behind pectineus. So again, I've not really drawn this in the right order, but, oh no, blue, 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 blue. So it's going to come off all of here. Yeah, it's going to come off the entire front of the obturator foramen, yeah, around the entire rim of the outside of it, yeah. And then the obturator externus muscle inserts onto something called the trochanteric fossa. Now the trochanteric fossa is again, yeah, it's mostly on the posterior aspect. If this is your greater trochanter, then this little dip is kind of your trochanteric fossa. Okay, so it's still posterior femur, yeah, but it's very high posterior femur, yeah. So we're sort of going, douche, douche. It's still going to go behind the leg, behind the femur. Sorry, I've sort of not drawn that very well at all, have I? So we're going that way, yeah, to then insert onto the trochanteric fossa like that. Okay, so you think about how this muscle works. When it contracts, when it gets shorter, it is going to pull the thigh in. It is going to adduct, yeah. Obturator externus also has a big role in lateral rotation of the thigh, yeah, because this is on the back. You can imagine if this is pulled that way, yeah, the thigh is going to rotate outwards, yeah, so external rotation of the hip, yeah. So that's obturator externus, yeah, deep behind, it's underneath pectineus. Pectineus is over the top of it, yeah. So gracilis. Gracilis is the last of our 6 medial muscles. Gracilis, yeah. Gracilis, I don't actually know this for certain, but I think it's called gracilis because it's graceful. Graceful gracilis. I bet that's completely wrong, but that's how I remember it. Yeah, it's graceful gracilis. Yeah, and I said right at the beginning, didn't I? This is the one that is by far the easiest to identify. Yeah, so thinking very like exam focused. If a question ever comes up, please name and identify any muscle that adducts the thigh. Gracilis. Any muscle innervated by the obturator nerve. Gracilis. Yeah, because any muscle that's in the medial compartment for gracilis, yeah, because it's so easy to identify that any of these sort of buzzwords, gracilis is your friend, yeah. So gracilis, truciform, they all do, this ischiopubic complex, yeah, gracilis comes off mostly the body of the pubis and a little bit of the inferior pubic ramus, yeah. And then it's called gracilis, it's called graceful gracilis because it's a very long, thin muscle that will go down the medial side of the thigh, actually crosses the knee joint. It doesn't insert onto the femur at all. It actually then inserts onto the medial tibia, yeah? So this is all gracilis. Okay, so the reason gracilis is so easy to identify on specimens is 1, because it is the most medial muscle of the entire compartment. Yeah, there is nothing further in than gracilis, yeah, of the thigh muscles. And because it's so long and thin and ribbony, you can very easily see it travel down the entire length of the medial thigh, past the knee joint to insert onto a small tubercle on the medial aspect of the tibia, proximal tibia. Okay, so that is gracilis, and it's nice and easy to identify, yeah. And they're the other 3, yeah. So to put all together, 6 muscles in total, 3 of them called adductor, longus, brevis, magnus, and that's from front to back. Let's be muscles, yeah. You've then got the other 3. You've got pectineus, which is arguably medial compartment, arguably anterior compartment, arguably both. You've got obturator externus, which comes off the front of the obturator foramen and then nips behind the hip joint to insert onto the trochanteric fossa. And then finally you've got graceful gracilis, which is by far the easiest of these muscles to identify, running down the entire length of the medial thigh, medial to everything else, all the way down to the medial tibia. Just bear in mind then that whilst gracilis is definitely going to be an adductor of the thigh, it is going to do this, it's also going to act on the knee joint, isn't it? Yeah, this is a muscle that is crossing 2 joints here. It's not only crossing the hip, it's crossing the knee. So in terms of its function, gracilis will act on the 2 joints. Yeah, it will adduct the hip. It will also have a role in flexion of the knee. Yeah, it flexes your knee joint. Okay, so just be aware of that. Okay. I mean, this one's definitely a little bit clearer than the first one, than the adductor one. Yeah. Okay, folks, that's it for this video. So if we go back to those initial basics to build on, hopefully we're now a little bit happier that The muscles of the medial compartment of the thigh all adduct the thigh. They bring the thigh back towards the mid-sagittal plane. They're all innervated by the obturator nerve, which comes off of L2, L3, L4 of the spinal cord. There are 6 muscles to know about in the medial thigh. 3 of them called adductor, longus, brevis, magnus, and then 3 others, pectineus, obturator externus, and gracilis. In terms of looking for these muscles, in terms of what to know about these muscles, just remember that very, very general, they all come from the front of the pelvis, yeah, that ischiopubic part of the pelvis, and they all, by and large, go to the posterior femur. Yeah, start off with that, make sure you're happy with that, and then get into the nitty-gritty details, because otherwise you just try and learn too much too quickly and you just sort of disengage. Build the knowledge forward in stages. Yeah. Remember, let's be muscles. So from front to back, from an anterior view, you'll see adductor longus first, brevis underneath it, magnus underneath that, and then just remember graceful gracilis. By far the easiest muscle of this group to identify in an exam sort of time pressured situation. Just remember, it doesn't insert onto the femur, it goes below the knee joint and inserts onto the tibia, which means it's a knee flexor as well as a hip adductor. Okay, I hope that was useful. I hope you've enjoyed it. If you have enjoyed the video, please give it a like. If you enjoy me, please subscribe to the channel. And if you've got any feedback, good or otherwise, please put it in the comments below. All right, folks, thanks for watching and see you in the next one.